everyone, Dr. Rex Hamilton here at the Hamilton Eye Institute in Beverly Hills. I wanted to talk to you guys about treating nearsightedness, which is when you really don't see well at distance. A nearsighted eye is a long eye. It's long front to back. It's something you're born with. The traditional ways to treat that, obviously contact lenses, glasses, but also things like LASIK, which most everybody has heard about, or the SMILE procedure. Both of those procedures involve reshaping the cornea, which is this front window of the eye. If we look at the cornea, we see that there's a thickness here. And what we're doing with things like LASIK and SMILE is we're reshaping the cornea, we're taking tissue away. So for example, here is the LASIK procedure. We create a flap, we lift the flap up, and then you're gonna see here the laser, and each of these little shots is removing tissue from the cornea to change the shape. Well, we only have so much tissue to work with, you see right here. So if somebody is nearsighted to a level of say -3 or -4, I have enough tissue to do the reshaping. However, if somebody is, let's say, -10 or -12, then there's just not enough tissue to work with, and it wouldn't be safe to reshape the cornea. So we have an amazing alternative procedure. It's called the EVO ICL. You can think about it as like an implantable contact lens. So this is what the EVO Visian looks like. It's very soft, very flexible, very thin. This is the optic portion here in the center. So the way the procedure works is the first thing we do is we dilate the pupil. Many of you have probably had your eyes dilated before. We use drops to actually accomplish that. And then, first of all, we're gonna make an incision, very small incision. It's actually 3 millimeters. Here you see we're folding up the lens, and it goes in through that small incision and unfolds inside the eye. And then what I'm gonna do is go in and tuck these little foot plates here that you see behind the iris, and that's where the Visian is gonna live. And then the pupil comes down and we're done. And literally it takes 15 to 20 minutes to do both eyes. You're seeing out of the eye immediately. We don't have to patch the eyes shut. So it's a very familiar recovery, just like LASIK, basically overnight. And so it's a wonderful option for folks that are not candidates for LASIK. So if you've been told that you're not a candidate for LASIK for whatever reason, you should come in and we'll take a look and see if the EVO lens is right for you. The other category of patients that are candidates for the EVO, but are not candidates for something like LASIK, is in people that have irregularly shaped corneas. So if we look here, this is a really nice symmetric corneal shape. Well, believe it or not, there's people that are born that have somewhat irregular shapes to their cornea. And those are patients that we can't do LASIK on because it wouldn't be safe. This is another great situation for the EVO ICL lens. One of the conditions is called keratoconus. And so if you have been told that you have keratoconus, you should also come in and take a look and we'll see if you're a candidate for the EVO Visian ICL. This lens actually has been around for 20 years. I actually put my first Visian ICL in 2003. So it's something that not as many people know about just because LASIK is so popular, but it's actually been around for 20 years. And so it's a wonderful solution. I look forward to seeing you here at the Hamilton Eye Institute.